My name is Lisa Vekich, and I am the Lactation Consultant at Grand Itasca Clinic and Hospital. Breast milk contains all of the nutrients and antibodies that our babies need to help them grow and to thrive. Babies all require different amounts of breast milk. Some moms are able to make lots of breast milk, and some moms are able to make just a little bit of breast milk. All women's bodies are different. If you feel like your supply is going down, then the only way to try to bring that supply back up would be to provide more stimulation to your breasts, either through more breastfeeding sessions with the baby or using a breast pump to help boost your supply. So I visit all of the patients in the hospital while they're here at Grand Itasca giving birth. After the baby is born, I will make an inpatient visit to the mom and the baby, making sure the latch is correct, making sure the mom doesn't have any immediate questions. We just want to make sure that breastfeeding gets off to a really good start. So when I'm checking out a latch, I want to make sure that the baby is in the correct position, that the baby is moving its jaw in the correct way, that mom is not having any kind of tenderness with breastfeeding, and that the baby is content and satisfied post the breastfeeding session. There's a lot of old wives' tales where people think that they have to avoid certain foods or beverages with breastfeeding, and those are absolutely not true. There have been studies shown that if breastfeeding moms eat a big variety in their diet, lots of different ethnic foods and spices, those babies actually tend to have a toddler who's a less picky eater. So you can still have some alcohol, you can still have caffeine during breastfeeding. If you wanted to have a glass of wine with your dinner or a can of beer with some pizza, you can still have coffee. I wouldn't sit down and drink a pot of coffee in a sitting or have 6 cans of Mountain Dew. One thing that I do tell moms that I would not have at all with breastfeeding as far as caffeine goes would be the energy drinks, and that's because they haven't done a lot of studies on how quickly that transfers into the breast milk. So a newborn baby should breastfeed at least 8 to 12 times in a 24-hour period until that baby is about 2 weeks old. Once that baby turns 2 weeks old, that baby still might be eating 12 times a day, but it might drop to anywhere from 8 to 10 times versus the 8 to 12 times. So some of the early signs of hungerness in a baby is cooing, putting the hands to the mouth. If a baby cries, that's their absolute last sign they're telling you they're hungry. So sometimes if we wait until a baby cries to feed the baby, the latch isn't as well because the baby has become frantic at the breast, and it's really hard to calm that baby down to feed them. So sometimes nighttime feedings can be quite challenging because we've missed those early feeding cues. So some common complications with breastfeeding can be engorgement, plugged ducts, or mastitis. Engorgement is very common when your milk first starts to come in and your baby is just kind of adjusting to breastfeeding. If your breasts get too overly engorged, then you can develop plugged ducts, which are also very common, or mastitis, which is not so common. If you feel like you're having any complications with breastfeeding, you feel like you've tried some little tricks and they're not really helping, you start to develop a fever or flu-like symptoms, chills, body aches, then you'd want to come in to the clinic and you would probably end up getting put on an antibiotic for that. Grand Itasca Clinic and Hospital. Your health is our specialty.